For second and third trimester abortions, the most common procedure is dilation and evacuation, or D&E. Although the instruments used in a D&E are basically the same as those used in a suction curettage, the procedures differ in several important ways. First, because the fetus is considerably larger at this stage of pregnancy, a greater degree of cervical dilation is required. This dilation is accomplished in multiple steps, which means that most D&E abortions take more than 1 day to complete. On the first day, the patient's vaginal opening is enlarged through the use of a speculum. Then a tenaculum is locked onto the cervix and pulled until the uterus is brought in line with the vaginal canal. Next, the cervical dilation process begins with the insertion of a compressed seaweed product called laminaria. Before insertion, and it's not unusual for more than one laminaria stick to be inserted at a time, the depth of the cervical canal is measured with a thin metal rod called a sound. Once that's done, forceps are used to insert the laminaria and place gauze over the mouth of the cervix. The tenaculum is then released, and the speculum is removed. As the laminaria absorbs moisture from the cervix, it expands and dilates the cervical opening. This process generally takes several hours to complete, but in the case of very late-term procedures, it can take 2 or 3 days. In some instances, subsequent laminaria installations are required in order to achieve the necessary dilation. After the stage of the dilation process has been completed, the speculum is again inserted and the gauze removed. The tenaculum is then used to pull the uterus back in line with the vaginal canal, and the laminaria is removed. Next, greater dilation is achieved with the same progressively larger cervical dilators used in the suction curettage abortion. Once the cervix is sufficiently dilated, a cannula is inserted and the amniotic sac and fluid are sucked out. Even though the cervix is far more dilated in a D&E than in a suction curettage, the fetus is so much larger that it must be dismembered inside the womb and removed in pieces. Forceps are used to accomplish this and to remove the remainder of the umbilical cord. After this process has been completed, a curette is scraped along the inside wall of the uterus to dislodge any remaining tissue or placental matter. Then, the suction cannula is again used to remove whatever tissue was dislodged by the curette. When the uterus is empty, the tenaculum is released, the speculum is removed, and the procedure is complete.